Good morning, Julie. I really appreciate the time you meet with me today.
Good morning, Aurora. What can I do for you today?
Well, I would like to talk to you about my simulation project for my DNP program.
I do not quite know what simulation is. Does your project need the simulation mannequins and computers? With the current financial status, I'm not sure if we have the budget to buy the simulation mannequins.
Well, my project is a low-cost, low-technology simulation in the management of obstetric emergencies using role-playing. It may be a reenactment of an actual event or a enactment of a made-up obstetrical emergency. Simulation is also known as code drill, emergency drill, or critical event training. When we do the simulations, we need the obstetrical team to manage the obstetrical emergency.
What is being done about the LBG emergencies now?
Currently, we do interventions during the actual emergencies, but this is a hit or miss. Most of the times, the unit is very chaotic because not everybody knows what to do. The scary part is there are two lives involved here, the mother and the baby. Any delay in the decision by the member of the team can cause the mother or the baby or both to be harmed. As you know, obstetrics has one of the highest litigated specialization. Institute of Medicine stated that many patients die in the hospital because of medical errors, and these errors are preventable.
I am listening. This is very interesting. Can you tell me more about the simulation project that you're proposing?
Well, do you remember what Joint Commission said a few years ago about the main cause of medical errors is failure in communication? One of the objectives of simulation is to improve communication amongst the healthcare team because teamwork is important in the management of any emergency. Communication is an important component of the simulation. When the team communicates the obstetric emergencies and interventions, a focused communication tool will help in providing vital information in a systematic fashion.
What else will the simulation involve? You know, before I became the chief nurse officer, I was an ER nurse. I know that we learned from our mistakes from taking care of actual patients.
This is one of the advantages of simulation. We learn how to manage obstetric emergencies without compromising patient safety. Historically, nurses and doctors learn procedures and emergencies from actual patients. Whoever has the most experience will teach novice clinicians then. In simulations, we improve our knowledge and skills in an environment that does not compromise patients. We practice the event so that we can improve our skills so that when actual emergencies occur, we become competent in our care. Another important component of simulation is we call debriefing. After the event, we review the simulation in a positive and a non-threatening manner. In simulations, we encourage errors so that we can evaluate them during the debriefing. We learn from these errors so that we do not repeat them during the actual patient care. There are recommendations that we can get from these simulations, and we will make them.
Wow, this seems so fascinating. I know that with Joint Commission and CMS come to survey, this will be something that we can report to them. But what do you need from me to help you with your project?
Well, first of all, with you being the CNO of the hospital, I'd like to request for your support for the project. Can you spread the word around to the staff and the physicians? Their participation is crucial to the project. Another issue is the minimal cost of the training. I may also need your support in requesting for a room or the space for the actual simulation and the debriefing, because ideally, simulation is best done in a vacant patient room so that we do not have to move equipment and supplies. But it's also an environment where any actual emergency can occur.
I am very excited about this project. I am sure that this will be a great learning experience for the OB team. I will wait for more information regarding your project. You will give me periodic updates, correct?
Oh, absolutely. I will continue to have frequent conversations with you regarding the progress of my project. I will also provide you a written report once the project is concluded. And once again, I appreciate the time you spent to meet with me and your continued support with my project. Thank you very much.